Good afternoon, ladies and gentlemen. Today we have a special talk with Dr. Nat. We will use English, even though Dr. Nat is a Thai, but I think Thai may not be so strong. So we would like to talk about what you are working with and what do you see when you work with teens. First of all, I would like Dr. Nat to introduce yourself. Who are you and why do you speak English so fluently and your Thai is not so strong?
Good afternoon, Dr. Chisanu. So thank you very much for having me here. So my name is Nat. I'm a pediatrician at Chulalongkorn University, and I look after adolescents and also children to prevent HIV, and I also give HIV treatment. So at the moment we provide care to prevent HIV, which includes a medication called Pre-Exposure Prophylaxis. We provide condoms, and we also provide advice to adolescents to keep them safe.
Why do teens not use condoms?
I think it's not a conscious choice or decision from teens to not use condoms. I think that they have other things that they're more interested in. So they're interested in having fun, trying new things, having relationships. So it's not actively, I don't want to use condoms. It's, I'm interested in other things.
So for you as a doctor, teens have to pay attention to safe sex. Without condoms, are there more ways to have safe sex with or without condoms?
I think what I'd say first is what I've learned from the teenagers is when they say sex, it doesn't necessarily always mean sex where there's penetration. And so it's important to understand from them, well, what do you actually mean by that? And to answer your question about is there a way to have sex that is safe without condoms? Well, there are things that you can do to reduce your risk. So for example, if you use this medication called PrEP or Pre-Exposure Prophylaxis, you can reduce your risk of getting HIV by over 90%. And if you have any symptoms of a sexually transmitted infection like a rash or discharge and you get that treated, that will also reduce your risk of getting HIV. And so there's not just condoms, but there are other things that can also reduce your risk of having unsafe sex.
And what's the problem of condoms? You can buy it easily from 7-Eleven. Why do they not use condoms?
I think for most of them, sex isn't really planned. So they meet somebody that they like, and the energy of the relationship just takes them there. And in some situations, the teenagers will tell us, well, my boyfriend or my girlfriend doesn't want to use a condom. So there are lots of different factors. And some of them know that using a condom is better, but they're embarrassed to go in and buy one. Or they just have other activities going on that means that they can't plan in advance.
So PrEP is the other way.
PrEP is one of the ways that can help, but I wouldn't say we recommend PrEP alone. When we give advice to teenagers, we always say to them, it's a package and there are lots of different ways that you can prevent yourself from getting HIV.
Can you tell us clearly what PrEP is?
So PrEP stands for Pre-Exposure Prophylaxis. It is a medicine that actually in the beginning was used to treat people with HIV, but doctors realized recently that people who took these medicines, if they didn't have HIV, it stops from getting HIV. So in short, like the oral contraceptive pill is taken to prevent pregnancy, PrEP is taken to prevent HIV.
Is it safe?
Yes, it's a very safe medication, and worldwide, so in the West, in Europe, and in the US, in Australia, and lots of other countries around the world, it's now been licensed by governments to use.
And does it work well?
It actually works very well, and so if you do an internet search, you'll find that the numbers that people quote is between 90 and 100% that it prevents HIV.
But it cannot prevent pregnancy.
That's correct. It cannot prevent pregnancy, and also another question that we get asked a lot is, will it prevent me from getting other sexually transmitted infections like syphilis or gonorrhea? And the answer is no. It will only prevent HIV.
That is serious, more serious than other sexual transmitted diseases.
Yes, you could say that because it's not, HIV, as we all know, is not a curable disease. Even though it is treatable, it's not curable.
Dr. Nat, I know that you focus on MSM and TG teenagers. Why do you have to focus on this group of people?
So just to expand on the question, MSM means men who have sex with men, and TGW is transgender women. So people who were born as male but inside feel that they are female, and so live as females. And the reason why we focus on this population is because the rates of HIV infection in this group are much higher than the general population. It's around 10 to 20% in adolescents who are MSM and transgender, whereas in the general population, 0.1% of the Thai population have HIV. So it's much, much higher.
Is this a disease, a psychiatric problem? I mean MSM and TGW.
So we're referring to LGBT, and so people who are MSM or transgender aren't considered in the medical field, and this is recognized globally to be people with any disease, so it's a normal variant.
So I would like you to say a few words to teenagers who are MSM and TG. What would you like to say to them?
I think that I would say to them, it's okay to be who you are, and that your life is yours, and it's possible to have fun and live your life to the full, and also make that choice for yourself to have good health.
And how can they contact you?
So we have a Line account, and we also have a website, and we're very friendly here, and we're very happy to be contacted. So we will post some details on our website.
Then say a few words to parents who have MSM or TG sons or daughters.
I think I would say that everybody just wants to be accepted and loved by their parents. And I think the job of a parent is really to, number one, nurture their children, and number two is make them the best that they can be. And so regardless of what gender your son or daughter is, as long as you are encouraging them to make the right and safe choices for themselves, I think that's the best that you can do. And it's always important to focus on positive reinforcement. So encouraging them to do the right thing rather than condemning them about things that you would rather them not do, which actually a lot of teenagers already know what's good and what's not good for them to do, but I think they just need encouragement in the right direction.
And last, I would like you to say a few words to our society about MSM and TG teenagers.
I think I would just like to say that love is love, so it doesn't matter. Nobody is born choosing what gender they are attracted to, and I think that everybody can be a productive and positive contributor to society if you give them the opportunity to do so.
I feel that your job, what you are doing now, is very strange, and it is very beautiful also. What would you like to say about your work that you have done? What's your feeling working with this group of children?
I think that I feel very proud of the children and teenagers that we look after. I think it's not easy to be a teenager, and it's even harder when you live in a society where not everybody accepts your sexuality as you are. And I think that it's important to do the right thing and be yourself, even if it's not the conventional thing to do.
So thank you so much for choosing this job, and please keep going. I think there are not many physicians who work with this group of children that need help. So thank you so much for sharing your experiences with us, and good luck with your work, and hope that our society, our community understand MSN and TGW more at the present time and in the future. So thank you so much, Dr. Nat. Bye-bye.
Thanks very much for having me. Bye.